we're giving serious consideration to implementing a curfew that would be designed to restrict travel between key hours when gathering sizes tend to be dangerously in excess of the rules, late night hours, obviously. These late night situations in Winnipeg have expanded our number of COVID cases very significantly. According to Dr. Roussin, this is an action that we should seriously consider, and I am seriously considering it now. When we were abiding by the fundamentals, we were beating COVID. Then some of us lost our way, and now COVID is beating us. And we need to get back to the fundamentals in order to flatten the COVID curve, and we need to do that now.
When we talk about the full lockdowns, these have huge implications, and again, they're very difficult to necessarily get out of when you lock down so widely. We think we've learned a lot about this virus and ways to take a bit more nuanced approach rather than having to lock down everything. In saying that, we will take whatever measures we need to.
We had several hundred calls from great Manitobans alerting us to situations, principally group gatherings. Last week we had 3 tickets given out. That's not acceptable. That's not an adequate deterrent for the things that, like this event I just told you about, that are a real danger to people. So, later this week I'll be announcing stepped-up enforcement details where we are going to be targeting events such as the one I just described and others, because we need to do more. Stepping up our efforts to make sure that we enforce these rules is important. Fine to have rules, important to have enforcement as well.
I haven't received any information on tickets given out over the weekend. Certainly moving forward, that's the plan is that we expect these orders to be followed. And there is that desire and ability to be offering fines for people who are not following these orders.
Work on being part of Team Manitoba, frankly. We all need to step up and do our part. When we were abiding by the fundamentals, we were beating COVID. Now, some of us have forgotten about the fundamentals and COVID's beating us. We need to get back to the fundamentals. And if we do that, and I think we can, then we can flatten our COVID curve now. And we need to get back to green for the good of our seniors, for the good of our healthcare system, for the good of our small business people, for the good of our families, for the good of the security of the people of this province. We need to get back to green.